Okay, we are live. Welcome everybody to EdUp EdTech Talks. My name is Holly Owens.
And my name is Nadia Johnson, and we're your hosts.
And we are super pumped tonight here out on the East Coast, but our guests are out on the West Coast. We have Katherine Grill, who is a CEO of Neolth, and we have Kenny Thomas, who does tons of different things besides being a former NBA player. They are here tonight to talk to us about, and this afternoon, about mental health. This is a very important topic. Welcome on into the show, Katherine and Kenny. Thank you for being here.
Ladies first.
Oh,
thanks.
Come on,
always
Katherine.
a gentleman.
You know this already.
Thank you so much for having me. I'm so excited to be back for the third time on your podcast.
Yeah, we're like old friends now.
That's awesome. Thank you, ladies, for having me. I'm looking forward to chopping it up with you today.
Yes, 100%. So we definitely want to know. I could sit here and give great introductions about both of you. Both have tremendous bios, but I want you to tell the audience about you. So tell us about yourself, your journey into where you are now. Give us all the details.
All right, I know Kenny's going to say ladies first, so
I'll
just be quick. I'll be quick because I've already been on here, and I'm so excited for Kenny to share his story. But
you're going to help me be able to think of some stuff to
add. Gosh, long story short, I was somebody who always grew up. I grew up a little bit outside of Manhattan in New York, in a low-income family. There was really serious mental illness and the inability to access proper health care. So that was something that got me interested in mental health and trying to figure out how could we make the system better. So I went to school. I became a therapist. I worked in patient care for a little bit, but pretty quickly found that the good care was given to the people who could afford it. And that just didn't sit right with me. So I wanted to figure out, how do we get over some of these huge care inequities that we have in the mental health system? I went back to school. I did my doctorate in neuroscience, and I wanted to learn how to build and validate new evidence-based, health interventions that just made things more accessible for people. So long story short, I got into adolescent health. I was doing NIH research, these big clinical trials, and my kids kept asking for digital because that's where they were. And about 6 years ago, I moved out to California. That's where I am now. I'm in LA, and wanted to see what we could do with technology to make healthcare more accessible. And we ended up building Neolth.
Great story. And you're so right about that access to mental health and resources. And sometimes it feels like we don't have the access that we need to help us and support us in some of these. Life is very much trials and tribulations to get through, especially the youth of the world. Absolutely.
And kind of also helping to get rid of that stigma, because there's so much. And I think that's super important. Yeah. Okay, Kenny.
Your turn, Kenny. Woo!
Breaking that cycle is huge, especially coming from a minority perspective. I'm from Douglasville, Georgia. I was raised military. I was able to go to a couple different places. I was able to go abroad from like 5 to 11. I lived in Germany. But then my dad came back to the States, and we ended up in El Paso, Texas. And there's a lot of different challenges and a lot of different things growing up from my perspective, being an only child and being in a situation to where I have to travel and leave my friends and different things like that behind and then start all over. That was a huge, it had a huge effect on me, especially when it comes to a mental health component. And then being able to go to college and play basketball, people think it's easy, but it's really not. And then being blessed to be able to go to the NBA and stay in the NBA for 11 years, it was a hard grind. And there's a lot of mental aspects that I wish I would have had Katherine's app to be able to cope with different things. And hearing her talk about all the different ways that her app, Neolth, has affected so many different people, not with just kids, I felt like this was a great opportunity for me to be able to partner up with her, try and create opportunities for more kids, especially in markets where I have a significant visibility, like New Mexico, because I played college ball there, and then Sacramento. Now I work for NBC Sports California, and I do TV, and Houston, trying to go there, and then at the same time, probably creep into Philadelphia, another place that I played. But being able to be a part of this and continue to spread the knowledge, and it's okay to talk about mental health because there's not a lot of people that are comfortable with it. I know I wasn't, and I'm still adjusting myself to this day.
Yeah, I think we all are, and definitely it took a toll on our country when we talk about COVID and the mental health. I think it's, released some of that stigma because of what happened to us with the pandemic, but also too, it is very difficult to be comfortable in yourself and, talk about different things that have happened in your life. But I think that's where the human connection lies, and what Neolth does is really, brings out the best in people, but it also gives you that support, and you don't feel like you're alone. You have that support.
Yeah, absolutely. So you kind of talked a little bit about your journey, but can you give the audience a little bit of an overview of Neolth and kind of like what the app does for users?
She could go on forever with this.
I
That thing does everything.
So yeah, be careful what you ask.
I put a link in the chat too, so people can go out to the website and check it out.
Yeah, exactly.
Yeah, I mean, so Nadia, like I said, I was at Children's National, a pediatric hospital in DC, and I was working with lots of teens, and they kept asking for digital. So I was really interested in getting their perspective. Instead of just being kind of the doctor and coming in and saying, this is what you need, it's like kind of asking the kids, what would work well for you? And that's really how Neolth was built. We've had about 500 young people now work with us on co-development and making content for the app and all these different things. And what we decided to build together was a self-guided mobile app. And it does a couple of things, but there's a lot of educational content about mental health because we know they're going on their phones, they're searching social media and like YouTube and other stuff. So we want Neolth to be a place where they can search and get their questions answered. There's a lot of stigma reduction. So there's people like Kenny, there's so many young people, they're sharing their experiences with mental health. And we just know how important that is. And that makes you feel less alone. And then there's a lot of different life skills, things built by therapists so they can build up, emotional awareness, better communication skills, healthy relationships, all of that. So it's really a self-guided journey. We personalize the content for them. And then we also have an AI system that can do crisis monitoring, which is really awesome, and flag kids who are struggling and connect them right away to a crisis counselor.
I love that crisis piece of it and incorporating the AI in that situation, because if things are happening or somebody's typing something or there's something out on social media, because I'm not saying we're old, but we didn't really have to deal with social media. We didn't have to deal with social media back in our day. Back in, we had the phones with the put the minutes on the phones, no texting, that kind of stuff.
Oh my goodness.
Remember the dial? You remember the?
Oh yeah. Spin around
on the phones. Catherine's like, what?
No,
she don't know
I grew up with my grandparents, and my grandma had that phone, so I know exactly what you're talking about.
Oh, my bad, Nadia. Really... I should have said you.
So it's really great. You're meeting the learners, the students, anybody where they're at in life. And I just love that about the app as well. And then incorporating the AI and not being afraid of that to, identify those crisis type situations. I'm
a personalized learning person. So anything that's to the user and is like personalized, I'm all for. Because everybody's needs are totally different. And I think when we can tap into every user, every person, at least in some capacity, that's awesome.
100%. I mean, you see this. Go ahead, Kenny.
No, I was just going to say, I like the fact that you're able to do it within your own privacy to where there's not anybody around, to where you can feel comfortable expressing and doing whatever you need to do. Yeah, that's all I was going to say. Now take it over from an educated perspective, Katherine.
No, I mean, you all should be salespeople. I mean, you just said it all, but I think you hit on a couple big things. Definitely being able to do it in the privacy of your home, because we know that there's so much that happens before, a young person would walk into my office as a therapist. And a lot of that is digital, and that, they're not comfortable just, I'm struggling, I'm going to talk to an adult, I'm going to walk into the therapist's office. So being able to have that kind of stepping stone to clinical care is so important. And that's really what this can be. And not having it disjointed. I think there's so many different things in the behavioral health system that are just fragmented, especially when you think about things like SEL and these self-guided, mental health curriculum is not connected to clinical services. but that's the perfect way to identify kids who are struggling before the point of a crisis and then connect with them so something bad doesn't happen. So having that kind of integrated systems and connecting we call the tier 1, tier 2, and tier 3 support, so like prevention, clinical, and crisis services, I think that's really a key component to what we do.
Absolutely. And
whatever she just said.
Yeah. +1. Plus
right.
one. So Kenny, you talked when we were in the waiting room, you talked a little bit about your ties to New Mexico. Can you tell us a little bit more about the various like organizations and things that you work with around New Mexico and in Sacramento?
Goodness.
I know. It's a podcast. We can have a conversation. You can be lengthy. It's all good. We want to hear about it. That's why you're here.
It's okay. Where do I start? Well, when it comes to New Mexico, this is my foundation. This is kind of like where everything kind of started. Especially from the age of like 12 and on, to where taking basketball to the whole next level was being put in place, because I was a part of an AAU team that we were on a national level, and being able to come out of my shell at such a young age, playing on a significant high level, and against some like amazing guys that are like that I ended up playing against in the NBA has been unreal. And right now in New Mexico, it's always been like one of those things that's been a passion for me, is giving back. The way I was raised, you have to give, you have to give back because you're supposed to. And then 2, in order to receive any more blessings, you have to give back. Those are a couple of models that I try and follow, and I just do it just to give most of the time anyway, to where I'm not necessarily receiving something. Right now, I'm on the board for ALS New Mexico. I mean, I'm not on the board. Excuse me. Let me rephrase that. I'm actually an ambassador for Make-A-Wish New Mexico. So I do some things with them when it comes to raising money. I'm on the board for the University of New Mexico Black Alumni chapter, which is us helping the Black alumni. And you don't have to be Black, of course. Obviously, if you're an alumni, you can be associated with the university chapter. That's been 2 years. I was on the board for ALS for 2 years. I'm not on the board for ALS anymore. There's a lot of different things that were being done in New Mexico as far as like that whole disease and the muscles and all that. And I was happy to be a part of that. Just had a golf tournament for the Boys and Girls Club up north, where it's an underserved community and it's not as big as Albuquerque. So I went up there. It was through a senator of mine, Senator Leo Jaramillo, who's a good friend of mine, and he's from Espanola, and he was actually a cheerleader at the time when I was playing at UNM. So we got to reconnect, and kind of we're just building this relationship and like connecting me with different community people or programs that we think that fits with my brand, and promoting different things. And I'm also on the African American Chamber here for the state of New Mexico. I'm on that board. But there's this variety of different things that I have going on, and there's always multiple people trying to come at me and wanting me to do stuff in the community, and then majority of the time I just do it, especially if it fits in my schedule. And yeah, those are some of the things I do here. But let me add this: City Year Sacramento, I'm on that board, so I do some stuff in Sacramento as well when it comes to the kids. And Katherine, we're doing some stuff with Neolth in City Year right now. And City Year is a organization that does stuff with kids as far as housing and some other stuff as well.
Well, you're one of the humans is the reason I started this podcast, is the way that you're giving back and wanting to tell people's stories, because I don't think enough people's stories are told and how they got to where they're at, and how, especially when we're talking about mental health and how we connect as humans through the trauma that we've been through and what that looks like. So thank you for giving back and doing that within your communities that you're involved in. We love what you're doing, and I've read a lot about you since we first heard you were
thank
coming
you.
on the show. So thank you for that and sharing that.
Thank you. Yeah, I try to attack the places where I played because I have a brand there. And then here in New
Absolutely.
Mexico, the nice thing about it is we got Colorado, we still got Texas right there, and we have like
Yep.
Arizona. So if I'm able to branch off and do things and just kind of stay in the forefront of the areas that have done so much for me, and then just trying to build those up.
Yeah. But the sports part of me is trying not to ask you sports questions because
Just
I love
ask me. Go
sports.
ahead.
I know. No, I'm not yet.
I'm
I'm
already
gonna wait a
used to
little
it.
bit longer. I was in the queue this morning. I'm a huge Orioles fan. And I was in the queue this morning for about an hour trying to get playoff tickets, and I managed to secure 2 to the ALDS and the ALCS. So I am pumped. I am so pumped. But I'll ask you. I'll wait to ask you questions. We really. This isn't about me. This is about
Yes, it
talking
is.
about
This is your podcast.
talking about mental
It's
health.
both of you guys, Nadia and Holly's podcast. Even though it's not named that.
No, we're not in the title. We're not in the title, but it really, like, as a former athlete and seeing what you all are doing and what you're bringing together, it's really uplifting. So thank you.
Yeah.
Oh yeah.
And since Holly kind of prefaced bringing together, I'm kind of interested to know, how did this amazing collaboration happen? Like, how did you guys meet up? How did you guys collaborate on this? Can you give us a little bit of the story behind that?
Go ahead, stud.
Not me. All right.
I'm smart. I allow the women to talk. I'm smart.
You got to figure it out, Kenny. You got to
Kenny's very
figure it out.
charming. Yes.
He is.
Yeah, I mean, it was just, I think, kind of like right time. And we're both, I think, I'll let Kenny speak to what he was looking to do as far as mental health stuff. But we had a mutual consultant who was kind of working for both of us. And one of the big things, again, being a clinician, kind of coming from healthcare, there were so many people who were falling through the cracks. And it's usually the most vulnerable people who aren't getting access to healthcare through health systems. So I feel like for so long, we've kind of thought as mental health as like this black box, like it's within this system, and you can't do it in the community. You can't do it in other ways. So that's something I've always been really interested in my career, is like, how can we make this more accessible? How can we reach people in new and innovative places where they feel more comfortable talking about mental health? So the schools has always been one. We've done a lot of work with Neolth in the schools to reach the kids again before the point of crisis. And sports, I think, is huge because you're reaching a lot of people, especially young men, in ways that you might not otherwise reach them. So this, consultant we were working with was like, hey, I know this guy. He's interested in some mental health. I think you should just
very charming.
Talk. He's very charming. Just talk. And then, I don't know, Kenny, you can take it from there.
Yeah, it's me still trying to follow my path, which comes down to giving back, right? And I have a platform to do that. And being able to come into a situation where Katherine has laid out all the foundation. Here I am just trying to come in and use my brand to help support her, and then just continue the mission. And the mission is always trying to get people involved and feel comfortable with expressing yourself, especially when it comes to mental health. Because if you don't, you never know where you're going to end up. And being able to be comfortable within yourself and expressing those, I think that's key. And if I'm able to touch somebody, even if their parent tells a little kid, "Hey, that this guy played basketball," if I'm able to touch somebody, I'm good with that as well.
That's awesome. You say it so casually. You were in the NBA for 11 years.
I mean, I have dreams.
Basketball. Kenny, I play some basketball when I go outside and try to play with the younger kids on the street, and they school me.
People, please do not listen to her. I am the most humble person ever.
You are.
Thank you. And I still have dreams, and especially with me doing NBA games now, this is gonna be my 3rd year doing TV. It doesn't seem real that I did that when I'm actually watching it.
Yeah.
Like, all the hard work and everything paid off, and I was able to provide for my family, and I'm still able to now, and it's been good to me. But now it's a different story. It's a different chapter in Kenny's life to where I need to help others. I used to entertain, but now it's different. So if I can open up some doors to get this mental health app going, I'm gonna do it.
Absolutely, and I think that's so amazing. I'm so like enamored with you. And Katherine, I talked to her. I was like, oh my gosh, I'm so nervous. She's like, Kenny is wonderful.
Nervous
He is
about
so chill. I mean, I've never interviewed like a person of your stature.
Oh,
I guess
seriously?
you could say.
Are you kidding me? We need to change that.
Yeah, we do. We absolutely do.
We are now, but we need to change that more.
We are. You're the first, so we're happy to have you here. And one of the things the questions I was going through my head and thinking about this as a like a former athlete myself is, and you being at the level of the NBA and the pressure and the practices and the playoffs and the championships and the money and the sponsorship and all the different things that you have to deal with when you start out in these rec leagues and then you go all the way up to the NBA. Yeah. How does that impact your mental health and how do you manage that?
It was hard. It was hard because I didn't think I was good enough to go to college. And then next thing you know, I have a great summer before my senior year and all these colleges come out, North Carolina, UConn, all the big schools. And here I am in Little New Mexico and I'm playing in a high school game and they've never televised a local high school game in the whole state. And I'm playing against one of my best friends, AJ Bramlett, who ended up going to Arizona and I went to New Mexico. Then we ended up playing against each other in college. And then I decided to stay here in New Mexico. And it was a state championship game, 18,000 people for a high school game. I'm like, I need to stay right here. And then I ended up getting 18,000 people for every game. And then they created dots around the arena for like standing room only. It was unreal. And just from a mental perspective, like, I didn't think I was good enough for college. I'll go back to that. And then once you get there, it's like, hey, I can do this. So I think it's a matter of tricking your brain to where don't tell yourself you can't. I can't do this. And as being a professional athlete, I got to the point when somebody told me I couldn't do something, I even wanted it more. So it's the same thing now in business. It's impacting me so much because I'm so competitive. If somebody tells me no in one door, I'll go open up 2 or 3 more doors. So yeah. I think that's been hard. I mean, that's been a growing process for me because I think it was a mental component to where I just wasn't confident enough. And I think this app will allow you to be more confident to where you know you can do certain things because I'm like 2%, 3% of this nation to a certain extent to where you get a chance to go to the NBA.
Yep.
So.
Yep. Yeah, absolutely.
Yeah.
It's just so amazing that somebody who's done what you've done and is giving back the way that you're giving back, but how comfortable it is to be in this space and talk in this space about mental health. I think we don't talk about it enough, to be honest with you. I think it's something, and that's one of the things that we wanted to discuss here is the stigmatism around it. And especially I could think at a level of, any sort of professional league, the stigma when players, I've known it's been in the news, a few like NFL players or people who've taken breaks because of mental health issues. And I hear people feel like, what are they doing? Or I'm watching Get Up in the morning or, First Take and Stephen A.
I was in Philly when Stephen A. started. Yeah.
He's amazing. I'm not down to Stephen A. I love him. He's very entertaining. But just, thinking about like these players, they are humans as well.
See, people don't understand that. Like, they expect a professional athlete not to mess up. Like, the pressure and the little bit of anxiety, you have to perform. And if you don't perform, you're not going to get that contract. You're not going to play. Because if you're not playing, it's well, what do you do now? Like, your whole life, you wanted to get on a stage like the NBA. And then it comes down to numbers and production. It just does. And then You get paid off of your upside and what they think that can be. And you even have to be in the right situation with the right coach, like on the right team. And I was just blessed to be able to do that. And I didn't play my last 3 years. I'll add this. Like, I was making a significant amount of money my last 3 years. And I was a guy that played in college, that's played all the way through college. You get to the NBA, then you have to wait your turn. And then my last 3 years, I don't play, and I'm trying to get another contract. That messed up. That messed me up mentally, because I'm like, what am I gonna do next? Right? I wasn't a guy that took advantage of developing those relationships with partners while I was playing. That's one of the key components that Magic Johnson said, who's my mentor, that he wished he would have developed those relationships. And he's doing it now, obviously, but it would have been a lot
Commanders.
easier.
So he has
the Commanders. He has the Dodgers. He has the Sparks. I think he has a soccer team. It's just a variety of different things that he's created for himself, and it's all because of his brand. So it wasn't easy, because those 3 years, I'm like, what am I gonna do next? And I wanted another contract. And people don't know this. I made a significant amount of money, but when I signed my deal, I left like $15 million on the table because I thought I was going to get another deal. And I wanted to stay in Philly opposed to going somewhere else. So.
Yeah. Well, thank you for being vulnerable and sharing all of that.
Yeah. It's the least I can do.
Yeah. Giving us the insider perspective. And I obviously have tons more questions, but we don't have time for that right
now. Yeah, I played against Michael Jordan. Yeah, I did that.
I mean, obviously, but I'm not gonna fangirl. I really want to focus more on this topic, and I always do think about that, especially when I see and Nadia, this is your time when you tell me to be quiet. When I see things happen like what happened to Aaron Rodgers and what he's going through now, I can only imagine what that's doing to him mentally. He was so prepared and ready to go and get the Jets on the map, and then 4 plays in, he's done for the season, probably.
Yeah.
I can't imagine what that does to an athlete at any level,
He's Aaron Rodgers. Like, a guy like him, he'll get another chance if he wants. Some guys, when they get hurt, it's over. It's a wrap. And I know that he didn't want something like that to happen. Who does? Because obviously he wanted to prove himself. Like, I don't need to be in Green Bay to still be good, and I still got it at 39, right? But I feel like this is a guy that he's gonna come back. I don't think the story's over. And he has that right, and he's seen the same surgeon that worked on Kobe Bryant, from what I was told. So he's in good hands, and see what happens.
Yeah. And I'm just thinking about the different levels too. Even when that happens when you're like high school or college, and you just, you're dealing with classes and grades and parents and relationships.
These kids are making $200,000+ to go to college.
Like, nowadays.
Don't go there. Don't go there. High school too. These kids are making money. If I was in college and we had NIL, oh my goodness, I would have wanted more years in college. Man.
Yeah. Yep.
Well, I'm interested to know a little bit more about the details of the projects that you're collaborating on with the Department of Health in New Mexico, or any additional, projects that you'd like to share. But I'm interested to kind of dig into that if you're willing to share a little bit with the audience.
For the boss lady on that one.
Yeah, absolutely. I'm ready. No, yeah, I mean, part of the work that we're doing across the country, but in New Mexico and with the Department of Health, is really what we're doing today. And I just want to, again, thank Kenny for being here, because you don't, 10, 15 years ago, right? Like, when we were in school, you didn't see people talking about this and being open and vulnerable about their mental health. And now imagine, for any of us as adults, but especially the kids who are watching this, all the things that Kenny was feeling. He's talking about not having confidence, not feeling good enough, trying to reinvent yourself or decide what to do after school or after a career change. Like those are things that even people at his level deal with. And I think that kids don't always realize that. Just to have somebody just come out and be open and vulnerable about that is huge. So I want to thank Kenny for that. And that's a big part of the work that we're doing. So one thing we're doing with the Department of Health, we're really excited about this. We're going to be in Albuquerque mid-November. We're keynoting the DOH conference. So we're going to be able to chat with all of the people in New Mexico in mental health, school-based services, and really just get that conversation going and talking about, mental health in general, reducing stigma, and really starting to talk about EdTech, which is, I know what this podcast is about, but some people might be surprised to know a lot of schools, yes, they're using technology, but they're not using mental health technology. And the idea that we have mental health within the schools is still very new. COVID kind of accelerated this, but it's not like all the schools are doing this and it's so easy and comfortable and they've been doing it forever. So Kenny and I are going to be able to go there and just talk to a whole lot of people about some of the work we've been doing at Neolth and really just talking about best practices with mental health technology to get the schools a little bit more comfortable with EdTech. So we're pretty excited about that.
That's awesome.
I got a question for you guys. What are these numbers on this screen?
Which numbers?
I got like 95% on mine. What are these numbers that are coming in and out? I've never seen this before.
Oh, that might be like your audio quality or your video quality that's coming in.
Oh, okay, cool.
Yeah. It's telling you how wonderful you are. You're doing fantastic. It's giving you positive reinforcement.
You just did a good job. You can say it again. I'm just kidding.
Katherine, I want to talk a little bit about what when you're going into schools, and I know that it's K through 12 higher ed, like what are some of the things that you do, and what, bringing Kenny in now, what's that going to do for the platform? How is that going to make a positive social impact and, in the larger community, because it's not just going to be in New Mexico. And our podcast is international, just saying. It's going to be around. So people are going to start contacting you from other countries. So be prepared. So how are you going to, scale that? But beyond that, what's the impact that you think it's going to have, or that you are already seeing that it's having when you bring it into the schools and to these children?
Oh, yeah, I guess a couple different things. And one of them is kind of going off of what I said before, is that mental health in the schools and mental health technology in the schools is still really new. And Kenny knows this from being on, I don't know how many conversations with me now and different potential partners, where it's not like, oh, we've done this before. Okay, great, let's do it again. It's really starting from day zero of what is this technology? How do we use it? What's the rollout plan? So there's so much to do there. And one of the exciting things that we're starting to do is kind of even take a step back from implementing the technology and just having conversations like this, or keynote conversations, or Kenny has graciously kind of opened himself up to speaking engagements and going into, schools and different opportunities. He does so much. He's really humble. He does a lot about, basketball tournaments and reaching thousands of kids in New Mexico. So having these opportunities to just kind of get your foot in the door and start to discuss mental health, that's like a stepping stone to implementing the actual program, which, as we've seen, can be implemented as a self-guided service, kind of opt-in for students, or in some schools, it's even integrated into the curriculum.
That's awesome. I love that you're kind of creating that buy-in, kind of getting them just warmed up, excited, and to talk about these kind of topics and making them feel comfortable around it.
Absolutely. I feel like like I said before, it's just not something that's talked about enough. And you can feel like kind of isolated when you're having those kinds of issues, in school, and you can go to the counselor, but maybe that's not the support that you necessarily need. So bringing this to the table is really going to help a lot of people.
And they're kind of spread thin too, counselors. Because I almost went down that road. I started my degree in counseling, school counseling, and the pandemic hit, and that kind of, not really messed it up, because I feel like I'm where I'm supposed to be, but, it kind of put a little halt on the plan. So I think school counselors as well are spread thin. So it's kind of nice to have that additional support for students.
Yeah. Absolutely. And Colton's making an appearance. It's my dog, Colton. He's saying hi. Yeah, I have so many questions floating through my head and things that I want to talk about with both of you. And again, Kenny, thank you so much for being here, and Catherine, thank you for doing what you're doing. And really looking forward to hearing how things go with New Mexico and the keynote. Congratulations on that. That's amazing. Awesome. We hope sometime you'll come out to the East Coast to do some things so we could all meet up in person and say hi. But one of the things that I do want to mention is that, like I was saying before, these athletes, these people, they're humans. They do have real problems. Neolth really puts it out there for people to take this journey and personalized learning, and everybody needs to go definitely check it out. But in wrapping things up a little bit, are there any other sorts of projects or things that you have coming down the line that people should know about besides the keynote that you want to share and want to get out there? We're going to share everything because this is going to become an episode as well in the show notes and out there for, LinkedIn world, YouTube world. Everybody's going to be able to find out what you both are doing in this wonderful collaboration.
I mean, we have a variety of different things that we're working on. We just kind of brought up the keynote speaking thing because we know that that's happening. We can't talk about things. I can't talk about the things that we have going on because they haven't actually happened yet. So I don't know if you want to add to that, Katherine.
Yeah, without being too vague.
Don't violate any NDA agreements. Remember, that's always my thing. And when I ask this question, no NDA violations. We don't want to get in trouble, but whatever you can share.
This is what I'll say about some of the work Kenny and I are doing. It's really about being creative and how do you meet young people where they are. And some of the things that I think about is, and I think we talked about this, Holly, but remember those kind of kitschy, public health video series that they used to have after school specials.
Yeah.
But in their own way, as goofy as they were innovative because they were on TV and they were trying to meet young people where they were.
You remembered it. You did something.
So it's kind of the same thing now. And we're thinking about media and technologies and some different partnerships and maybe some video series that we're looking forward to announcing soon. But how can we bring together, people like Kenny who are really role models with young people talking about mental health, and just meet them in these kind of digital mediums where they are. I think that that's going to be really exciting. So kind of keep posted before we make those announcements. But I think there's going to be a lot more around that. And even stuff like he had mentioned with, basketball tournaments and sports and some other folks that he's working with. It's a really great way to meet young people outside of the doctor's office. Not that the doctor's office isn't important, but there are so many people who aren't ending up there for whatever reason. So I don't know, Kenny, if there's anything you want to share about the basketball tournaments and all the kids you're reaching. Yeah. There's so much there as well.
Thank you. I actually just did a tournament for Memorial Day weekend. I partnered up with the city of Berlin, which is on the outskirts of Albuquerque, to where we had 18 or 19 gyms in Valencia County and kind of in the whole outskirts of Albuquerque because we use Berlin's gyms and things like that. We had 250 teams, boys and girls from 7 different states. So kind of what I'm doing is I'll have a tournament in Albuquerque and then I'll go to Roswell, New Mexico, which is right there by Texas, El Paso, where I live. And then I'll go to Hobbs, New Mexico next year, which is right there by Texas also. And then up north, Santa Fe area where I just had my golf tournament up there. And then there's just other opportunities of other places like Houston. I'm looking at having a tournament there. Sacramento, of course. And then if I'm able to go to Philadelphia, that's fine as well. And in that big tournament that I had, we had teams from Chihuahua, Mexico, Arkansas. Now they want us to go up to Arkansas and do a tournament. The nice thing about it is in these different areas, I'm creating partnerships with the cities to where if they let us use their facilities, they get the opportunity to be able to make money as well. If it's a percentage of the door or if it's concession or whatever it may be. And we're not charging a lot per team. We're charging a few $100. It's not it's $600-700 for 3 or 4 games, and it's a couple hundred for 3 to 5 games. And then they get trophies, and then they get to meet me because I'm jumping around to all of these facilities and taking pictures and the visibility there, because with my name being attached, they obviously want to see me being there. So I'm not going to be able to make them all, but it's becoming a regular thing to where I'm having tournaments on a consistent basis. Like my next one was coming up in December here in New Mexico. So it's going to be around the holidays to give the kids an out during that time, because they're usually on breaker day, to keep them active and have them doing something.
Absolutely.
Yeah.
Oh my goodness, you're doing a lot. Well, I heard Philadelphia, so that's over this way.
Yeah, we haven't started up there yet, but I'm hoping to get into that market with some other things that I have going on with some of my business partners out of LA. Yeah, we'll see what happens.
I love everything that you're doing, and I'm sure that we could probably talk for hours and hours, because you're just so genuine, and you're just so, you are very charming, and it's been an absolute pleasure having you on and putting you on this platform and expressing your vulnerability. And also, Katherine, you know I admire you and all the things that you've been doing, and watching Neolth grow to this point is unbelievable, and I can't wait to see where it goes next. So we want to wrap up with some final thoughts. Anything else that you want to share with us or share with the audience? Anything that we forgot to talk about? Because I'm just so into my sports brain right now. I blame Kenny for being a professional athlete. So anything else that you want to share with the audience?
Ladies first.
All right. Well,
because I'm about to pump my social media.
Yeah.
Oh, yes. And his wine company. Kenny has so much going on. It's so cool to work with like a fellow entrepreneur and really get his perspective. But to kind of bring it back to the EdTech before we jump into Kenny's stuff, because I know there's a lot of people listening and EdTech is their thing. I was just all day kind of looking through some data. We had a big implementation with a university. I'm not going to name them because they probably want to make the announcement about some of this data coming out. But we were looking through some of the data coming out. We did a large study last year with schools. And something really cool that I noticed from this data coming out is that we had worked with schools. These are K-12 schools, and they were kids with really more intense behavioral health needs. And I think a lot of times when people think mental health, they think, anxiety and depression. But these were sites, and as far as I know, for the first time, where we were looking at digital mental health with, yes, those kind of traditional mental health conditions, but also comorbid with things like ADHD or autism. So they had like a combination of kind of developmental and mental health issues, and we were trying to support them all. And what we found is that when we use this classroom model, so teachers integrating it into the classroom, reducing stigma, talking about mental health, over 50% of the kids in these schools were what we are calling super users on Neolth. They were logging in 30 plus times throughout the school year. So it's not like they're signing up once, not interested. Like they're going back and they're going back. And we're about to release a case study about it with like all these nice quotes from the kids where they show, this is how it helped me. That we used the crisis AI. It was able to identify a bunch of kids within 10 minutes. We could notify the schools and let them know if kids were struggling. So it's really cool to start to play around with this and implement it into the classroom and see how when teachers and other folks get involved in the school, how it can just bolster the effect of this program.
Yeah,
what she
absolutely.
Just said. I can't
Another
top
plus
that.
one from Kenny.
I can't top that. Kenny Thomas NBA social media handle. Follow me. That's all I got.
Yes, absolutely. Follow Kenny. He's so genuine, and he does a lot of great things out in the community. I've been low-key stalking you since Katherine said you were coming on the show.
Oh, Jesus. That's funny.
No shame in your game, Holly.
No, I have to research.
Don't hate. You feel the same way. It's all good.
Well, yeah, go ahead, Kenny.
No, I was just gonna say I would love to come back. Katherine,
Please.
Whatever you need, obviously, you guys just let me know. I had fun. Thank you. That's all.
Yeah,
I was gonna say.
we do Where Are They Now episodes, and we would absolutely put you at the top of the list. We want to see in 6 to 12 months what you are doing with this collaboration, how much it's spreading, and all the great things that you're doing, and share it with our audience, because we're all about stories and we're all about helping people here at EdUp EdTech. So we can't thank you enough, Kenny, for your time, Katherine, for your time and being with us this afternoon, this evening, and all the listeners out there. This is an amazing episode. Thanks for joining us. We really appreciate it.
Yes, totally.
Thank you guys for having me. The EdUp EdTech podcast. I said that right.
With Holly and Nadia.
Dang, I left that part out. With the amazing
okay,
Holly
I got
and
you,
Nadia.
Kenny. I got you.
Thank you, ladies.